Hey mamas, welcome to Breastfeeding Relief with Bethany. We share incredible stories, tips, and breastfeeding ideas to help on your journey. I'm your host, Bethany Laverne, a lactation consultant and speech therapist who helps mamas with breastfeeding. Not all breastfeeding stories are the same, and we dive into those topics. Welcome to Breastfeeding Relief with Bethany. Today we have on Dr. Nina, a pharmacist and owner of the oogiebear. And today we're going to specifically talk just about RSV. So we are currently in the middle of RSV season, Dr. Nina. So why don't you tell us more about RSV and some warning signs that we can look for?
Hi, Bethany. Thank you so much for having me. This is so fun to do this. I always look for 3 signs. I love the 3. It just sticks. I think mamas should know about it. Hopefully you can get to the pediatrician fast enough and get baby comfortable. But the 3 things that I look for is how fast is baby breathing. So the things that I look for is baby mad? If baby's mad, calm them down and relax them. If they have a high fever, give them some, fever reducing medication, any of them to be able to reduce that fever to, again, calm them down, because these are the areas where they might be breathing heavy and it might seem similar to RSV. So we want to make sure we're kind of ruling out what's going on with baby. A most important one is if their nose is blocked, they're not going to be able to latch on during breastfeeding. So you want to make sure that the nose is clean. And of course, we have a product for that, oogiebear. And it would be great if you can just clean out that nose, allow baby to breathe easier, and they'll latch on a lot better. And I think those are the 3 that I would just kind of rule out. And if you see that baby is breathing faster than normal, I would do like maybe, 60-minute or 60 breaths within a minute. And I would just, count 30 seconds and then multiply it by 2. And if you see and you're in the 40, 50, 60 range, that's time to call a pediatrician. You want to call the pediatrician, especially if baby's laboring, their chest is going in and out, they're kind of working really hard to get those breaths in. I would definitely reach out to your pediatrician and go from there. And hopefully, usually, they do a test. I'll tell you whether the baby has RSV, and most likely you're not going to go to the hospital. Very few, few do. But if you catch it and make sure baby's, feeding, they're peeing every 4 to 6 hours, and they're comfortable and they look okay, you're good. So those are kind of my go-tos.
No, that's such great advice. One thing I specifically think of, because when your baby's sick, what do they want? Mom. They want us, right? They want to use us as a pacifier because we're comforting to them. And it just, they want to be near us. But mamas, sometimes we struggle with being that pacifier because we need somebody else to hold the baby, but then they might cry. So one of my biggest tips I've started giving moms is take and freeze your breast milk like a popsicle. 2 of the best ways, just put it in an ice cube tray, some of your pumped milk, freeze it, and you can put it in a Mile Munchie bag. Also, EZPZ now makes a popsicle. It's just called popsicle. And you freeze it. It's real tiny, and give it to your baby. And 1, it's cold, so it's going to help with that fever, hopefully bring that fever down for you. And 2, it's going to hydrate them with your breast milk. So it's better than a friend the other day said, I gave my baby a popsicle. I'm like, please don't give him a popsicle ever again.
That's another podcast.
Yeah. Yeah. So use your breast milk to help you, to help reduce some of that fever, I would say.
That's amazing advice. That is so wonderful. And it sounds difficult, but really it's not. Once you get in that routine, it's totally doable.
And even moms, like we aren't saying pump 5 ounces of breast milk, right? You just need a little bit. You can even do less than an ounce. A half an ounce is enough to freeze for your baby. I might do an ounce to make a few popsicles, because it is going to take a little bit to freeze, but not very long because they're just so tiny. But it's one thing that you want to make sure, like you were saying, that they're having those wet diapers. And so that will help them have those wet diapers. And I feel like they really go for that cold because they are so hot.
Very true. Very true. And just, maybe feed them more frequently if you have to, so that you do get those wet diapers. But
Absolutely.
I love that advice.
Yeah. One thing you also talked about was their chest rising and falling. And I feel like as moms, when you don't know what typical is until you see atypical. And so one thing that was suggested to me when I was a new mom was actually video your child's chest when they're just healthy. And then you can compare that to when they're sick and you see how quickly they're breathing and trying to gasp for air on their chest. I always felt like that was a good suggestion to like compare both.
I agree. I think mom knows baby very well, and they know when baby's working hard to get that breath in. So trust your instincts on this.
Yes.
You know baby better than anyone else. So if you think your baby's breathing heavy, chances are they are.
Yeah, no, I think that's absolutely wonderful. So I love how you also said, go ahead and call your pediatrician, because I feel like sometimes as moms, we just rush into the emergency room. Yeah.
Been there, done that many times.
Sure. And I'm not saying that's bad, right? But it also, you got to pack up the kid. You got to go in, and then usually you're discharged pretty quickly. So could you maybe explain to mamas that their baby does have RSV, what that looks like going forward?
So actually, I looked into this and I talked to a lot of moms who had gone through that process. You do get a positive test in the office. And I asked a few pediatricians, so what then? Like, what happens if you go to the hospital and you get that positive test? What are they going to do? They're really not going to do anything more than what the pediatrician's going to do. Maybe if they're bad enough, they might give you an inhaler, or not an inhaler, I'm sorry, an oxygen for baby. And that sounds really scary, but that's just because they want to make sure that the oxygen's getting to the brain and they're comfortable and so forth. But there's not much more that they do other than that. And for what I've heard, it's very few that get there, and hopefully, it's not needed. And at your pediatrician's office, they can actually just give you the recommendations, keep a close eye, keep baby comfortable as much as possible. So that's kind of my findings.
Awesome. Well, thank you so much for sharing. I think this will comfort a lot of moms during RSV season, because I know it's something we worry about a lot during this season.
It's scary. It is very scary. And hopefully, we can take the fear out a little bit and just go with our gut instincts and be able to comfort baby and hopefully get out of it.
Yeah, absolutely. Well, thanks so much for sharing today.
Thank you. Thank you so much for having me. This was so much fun.
Thank you so much for listening in. If you loved this episode, it would mean so much if you would share it with another mama or post on social media and tag me. I want to personally thank you for wanting to help other mamas. You got this. I'm rooting for your breastfeeding journey.